Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. Now, even young adults are suffering from sudden cardiac arrest due to the sedentary and stressful lifestyles these days. Without immediate recognition of symptoms and CPR delivery, the chance of survival decreases significantly as minutes pass without a life-saving intervention. It has been proven that bystander CPR improves the rate of survival by almost 50%. If you have a loved one who has a history of cardiac disease, it's most important that you learn CPR. Research reports that the majority of cardiac arrests take place at home. Now, Save a Life is an initiative through which people will be made aware of the early signs and symptoms of a cardiac arrest, so that while patients await getting to a nearby hospital in time, those around them can be trained on giving CPR should the need arise. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Manish Jha, interventional cardiologist, director cardiology, department of Charak Hospital and SKD Hospital, Lucknow. We're also joined by Dr. Vishnu H, Bhute, a consultant and interventional cardiologist, RV Medicare Super Speciality Hospital, Jalna. Thank you so much, doctors, for joining us on the program today. Dr. Bhute, I'd like to start with you. There are increasing incidences of cardiac emergencies in India. Why are cardiac emergencies increasing among Indians?
Cardiac emergencies are increasing in India just because of there is an increase in obesity, and there is a high blood pressure, and that causes high blood pressure, sugars, and there is a dyslipidemia that increases the incidence of heart disease, which causes the clogging of the blood vessels, and that is increasing the heart disease, leading to the heart attacks and further problems to the patients.
All right, so that's one of the reasons why we're seeing such an increase in heart incidences. Dr. Jha, it is said that angina is a symptom caused by coronary heart disease. If you could explain what this is and what causes it.
Basically, angina is a discomfort of the chest on exertion. In angina occurs because of there is inadequate blood supply to the myocardium. In this case, heart is damaged just because of inadequate blood supply. Inadequate angina basically there is substernal chest pain, and that pain increases. Typical angina have increases on exertion, and it relieves with the nitrates drugs. Angina are two different types. What I have explained is, if these three factors are present, that this is the stable angina. Another one is the unstable angina, in which the pain is increasing. And angina, the pain is classically substernal. This pain may goes up to the jaw, and pain radiates to the inner aspects of the arm, maybe both arm or one arm, and it sometimes presents with the shoulder pain also. In the case of the females, elderly people, the angina symptoms are very vague. They may present with the dyspnea, discomfort, fatigue.
Right. Dr. Bhute, clogged arteries can lead to heart attack and stroke. Can blood pressure indicate blocked arteries?
Yes, ma'am. Just we are talking about what is the relation between the clogged arteries and blood pressure. So let us see first what is blood pressure. Blood pressure is blood force exerted by the heart during its contraction, which gets circulated into our body. So what is immediate response of blood pressure to the heart attack? So immediately it could decrease or remains unchanged or may increase. But that means it is in immediate response, it is unpredictable, but commonly after few hours blood pressure decreases. So why does it decreases? It decreases because of the blocked artery causes myocardial damage, which in turn causes the pump failure. So heart function goes down, that causes decrease in blood pressures. So another causes in patients with chest heart attack, they get the chest pain. So chest pain causes the vagal nerve stimulation, which causes reduction in the heart rate and the blood pressure. So this is another cause. And in patients with blood pressure may rise. Why does it rises? Because there is in immediate period the stress induced adrenergic drive goes up. So as the adrenergic drive goes up, adrenaline comes in our body, which increases the blood pressure for the short period. But after some time, blood pressure usually goes down. And if the heart attack is mild, so what happens? the mild attack, there may not be any fluctuation in the blood pressure. So how we'll manage the fall in blood pressure in patients with heart attack? So we need some drugs which increases the blood pressure, such as adrenaline, noradrenaline. We have the dopamine. These are the different types of drugs which are administered in ICU on the pump, and that increases the blood pressure. So patient has to reach to the hospital as early as possible once he get the heart attack. So, and in patient with the stroke, where there is a clogging of the arteries in the brain. So in this patient, in stroke patients, the stroke occurs usually because of the high blood pressure. So when patient with stroke comes to you, generally blood pressure is high. Why does blood pressure get high in this patient? Because there is a increase in intracranial tension in the brain. So in response to that, the heart tries to increase the blood pressure in order to maintain the perfusion of the brain. So blood pressure rises in patients with the stroke. And in heart attack patients, to conclude, the blood pressure falls usually. They need a drugs which increases the blood pressure. Yes, ma'am.
All right, thank you for explaining that. Dr. Jha, how does stress affect your heart? What heart conditions can be caused by stress? Because as we said earlier, in this day and age, people undergo a lot of stress, be it work or just, general life. So tell us about the role stress plays in heart health.
Right now we are seeing lots of younger people suffers from the heart attack. Stress is the most common cause for the younger people suffers from heart attack. Chronic stress leads to increase in the blood pressure, and blood pressure directly related with the heart attack and the events. And in case of the chronic stress, the people will do the lack of exercise, and simultaneously they do overeating and obesity. Stress increases the obesity, and these all factors leads to the heart attack.
All right, so important to try and decrease stress in one's day-to-day life. Dr. Bhute, what is the importance of medication adherence if you have heart disease, and what can help improve adherence for patients of cardiovascular diagnosis?
Medication adherence is extremely important in patients with the cardiac as well as the cardiovascular patients. If patients adhere to medication and do regular checkup and monitoring, it will keep good control on their blood pressure, sugar and the cholesterol, even reduce the heart failure. So it will prevent the heart attack, strokes, and even the peripheral vascular disease. So it is extremely important in patients with the angioplasty. Those are on blood thinner and the cholesterol lowering drugs like aspirin and clopidogrel. These drugs are extremely important as they keep the blood thin and prevent the clogging of the arteries. If the artery gets clogged, what happens? There is a patient get the immediate reinfarction, again the second heart attack, and which is more dangerous than the first heart attack, and that can cause cardiac death, even the death of the patient. So adherence to the medication is extremely important, and if the patient adheres to medication, what will happen? It will reduce the frequent emergency visits to the hospital, even the admissions, and the healthcare cost, overall healthcare cost, as the on OPD basis and medication cost is less as compared to the when patient gets admitted. So adherence is extremely important. So what can help to adhere medication is like there should be good doctor and patient relationship. There should be good communication to the patient. So there is a supervised medication. We can motivational strategies. Again, there is a feedback from the patients, counting the pills, giving the pills in the appropriate boxes. So it is morning dose, evening dose, night dose, and keeping regular touch up with the patients and taking regular follow up. So both parties has to coordinate with each other. So in order to improve the adherence to the medication, and it is good for the patient to adhere to the medication as it reduces the overall cost of the patient. Thank you, ma'am.
All right, Dr. Jha, is it possible to prevent or slow the progression of heart disease? If you could explain that to us.
Yes, it is possible to slow and prevent the heart disease by doing certain measures. First, we have to find out we have to look on what are the main factors which increases the heart disease. First is blood pressure. We have to control our blood pressure. Second, if we are a diabetic, then diabetes is one of the most important factors that causes the heart disease. Just control the diabetes and check your lipid levels, cholesterol LDL, HDL, triglycerides level, just control the, and apart from that, just increase exercises. We have to don't stick to the sedentary lifestyle. Just as per WHO recommendation, at least 30 minutes of the brisk walk is, or at least 5 days in a week is necessary. And eat plenty of fruits and green vegetables, and avoid oily and greasy foods. And last and most important factor is don't smoke, and even passive smoking can cause the heart disease, so try to avoid the smoking.
All right. Dr. Bhute, as most people still don't know the difference between heart attack and sudden cardiac arrest, many people may mistake recognizing the symptoms. So if you could, tell us, how does one know if it's a primary cardiac arrest?
When patient present with the cardiac arrest, they become usually unconscious and there is a pulse is not palpable. First, we have to make awake of the patient, try to talk to the patient. If he is able to talk and there is a pulse is palpable, that means it is not in cardiac. There must be there can be another cause. So if the patients get cardiac arrest, we need to give them cardiopulmonary resuscitation. So what cardiopulmonary resuscitation does to this patient, it is basic life support which restores the heart rhythm and the blood pressure of the arrested victim in patient who those get the heart attack or other illnesses. So cardiopulmonary resuscitation is extremely important in patient with the cardiac arrest. In patients who those are not arrested, they need another care like supportive care and supportive care like inotropic supports and hospitalization to the hospital. But the cardiac emergency is arrested patients are emergency. They have to be taken immediately to the hospital and should be treated according to them. So CPC, cardiopulmonary resuscitation, is the first treatment that has to be given to this patient. It concludes that it needs 30 chest compression at the rate of 100 to 120 minutes per minute, and after 30 compressions we need to give them 2 breaths, and this should be continue along with the when the advanced life support comes. So this is very important to diagnose the cardiac arrest from non-cardiac arrest. Yes.
All right, we'll slip into a short break, but don't go anywhere. We have many more questions to ask the doctors. Stay with us. Welcome back. You're watching Save a Life, and we're talking about heart health and what you can do to maintain a healthy heart. Let's go back to our panel of doctors. Dr. Jha, if you could tell us, lack of CPR awareness is a big health challenge in India. Tell us, our viewers, about what are the main steps of CPR.
True, Gargi, true. Definitely, lack of CPR awareness is one of the biggest challenges we are facing. By doing effective CPR, we can save thousands of the life per month in here. What are the main steps? Whenever we see a person who is collapsed or lying, just there are few steps. Just call for the help, and first keep the patient or a person lying down on the back, and just kneel down there and start CPR. The steps are: first kneel down there and you put your heel of the dominant hand over his breastbone or sternal bone, and interlace the other fingers, and just start doing compression. At least 120 compression per minute. Just start, and the height of the compression should be at least 2 inches, and just start doing chest compression, and these are the main steps. And immediately call for the help to other paramedics or ambulance to arrive there.
Right. Dr. Bhute, though intentions may be correct, wrong or half knowledge can also be dangerous. When should you not perform CPR?
So, as sir has rightly said, CPR is a basic life support which restores enough breathing and heart rhythm in victims of cardiac arrest. So when one should not one should not do the CPR when the patient is breathing. That means patient is breathing, pulse is there. So what happens if the already reached blood, oxygenated rich blood is going to the brain time being in the entire body. So when the scene is hazardous, like there is a fire or the car accident, you may land up in the problem. That time you should call for the help or call the expertise at the scene and then get it clear and then confirm that you are safe and then go for the run for the CPR. And when the scene is suspicious, that time when someone is trying to frame you, that time you should not rush for the CPR and call for the help. But whether the patient requires CPR or not, it's in an emergency, it's very difficult to determine. As we need to assess the situation, whether the patient breathing or not breathing, and if the patient is not breathing, pulse is not palpable, that time you should perform the CPR. In awake patient, arousable patient, and the pulse is palpable, that time you should preferably avoid the CPR and call for the help and take patient to the hospital. Thank you.
All right. Dr. Jha, sometimes regular checkups can detect the problem early and prevent emergency situations. So if you could explain who should be screened for sudden cardiac death risk factors?
I think every adult should be screened for the sudden cardiac death risk factor. So in case of sudden cardiac death risk factor, 80% are the causes are due to either coronary artery disease or cardiomyopathy or others. In case of the 20% of the disease, these diseases are autopsy negative. We can't find any evidence of coronary artery disease, but there are evidences of the electrical disturbance in the heart. In the case of coronary artery disease, just we need to do simple blood tests like ECG, echocardiography, treadmill test, and if we could find there is a cardiomyopathy, then we have to do some more imaging techniques just like cardiac MRI or PET CT. Apart from that, few regular blood tests just like your numbers, just lipid profiles, sugars, and blood pressure. Just you need to check down these things so that you can prevent the sudden cardiac death or any heart disease.
All right, Dr. Bhute, if you could tell us what is the first aid for chest pain? If somebody, is experiencing chest pain, what should the bystanders do? What should that person do?
And the first aid for the chest pain will depend on what is the cause of the chest pain. So if the cardiac chest pain is there, which lasts more than 15 minutes and it is increasing, and it comes from it associated with chest tightness from neck and even the up to entire left arm radiation, and its patient never feels that chest pain before. If such type of chest pain occurs in patients, that time we need to give blood thinner like aspirin 300 mg, clopidogrel 300 mg. These are the blood thinners should be given stat, and this cholesterol lowering drugs like atorvastatin 80 mg and the rosuvastatin 40 mg. These are the drugs should be given immediately. But if the chest pain is because of the chest wall, that time you need to give them analgesics that will relieve the pain. If the chest pain is because of the acid peptic disease, antacid will relieve the pain. If the chest pain is due to lungs like pneumonitis, we need to treat the pneumonitis. If other causes of cardiac chest pain like there is a pericardial effusion, pericarditis, that time patient may get chest pain, but you don't have to give the blood thinner. The treatment is altogether different. And when there is some clogging of the pulmonary arteries which takes blood to the lungs, that time also chest pain cause is different. We don't have to give blood thinner immediately. We have to call for the help. So if the chest pain is cardiac only, that time that is clogging. Chest pain is because of the clogging of the artery. That time which is lasting more than 15 minutes, heaviness in the chest, tightness in the chest. That time we need to give blood thinner and the cholesterol lowering drugs. That will help to the patient. Thank you, ma'am.
Right, Dr. Jha, if you could tell us about, exercise. How does exercise help lower blood cholesterol levels?
exercise helps in lowering the blood cholesterol. By doing exercise, there are some hormonal changes like endorphin, and body releases endorphins, and these hormones, by increasing level of endorphins, our stress level decreases, and even endothelium of the heart is stabilized. And exercise has multiple effects. Other effects, by doing exercise we can decreases the lipid levels. Our bad cholesterol level is decreased with the exercise, and good cholesterol HDL level will increases with the exercise. But and exercise increases our tolerance too. By these things, exercise improves the heart disease.
All right. Dr. Bhute, how does an automatic external defibrillator help a person who is experiencing a cardiac arrest?
Yeah, if the automated cardiac defibrillator is there, so it will, when the patient with heart attack get heart attack, there occurs arrhythmias. Arrhythmias means what? The heart rate goes up, and the heart rate may go up to the 400, 500, 600. That time patient is pulseless. There is no pulse. The cardiac activity is just, there is a like fibrillation. So heart doesn't contract properly, and there is no blood pressure. That time, what does automated defibrillator gives? It gives the shock. As it gives shock, the rhythm gets normalized. So automated defibrillator is extremely important in situation like cardiac arrest, secondary to the increase in heart rate, that is ventricular fibrillation, ventricular tachycardias. That will help to control the heart rhythm and then supportive treatment along with it. So automated defibrillator is helpful to the patient.
All right. Well, thank you so much, doctors, for sparing your time and joining us, to talk about these very, very important issues and creating awareness. Thank you all for watching at home. Goodbye.